Hey everyone, welcome back to the channel. So today what we're going to go through is one really effective way to free up a stiff neck. This is fantastic for anyone who has neck pain, if you suffer from headaches, if you get any pain into sort of upper back, into the corner of your shoulder, particularly if you get some neural symptoms, some nervy symptoms down into your arm, tennis elbow, golfer's elbow, a lot of RSI in the hands and fingers. A lot of it can come back and stem from dysfunction, from some dysfunction at the base of your neck or the neck and top of the upper back. So what's really useful to have is a way to mobilize that and free that up yourself that's safe and that you feel gives you some control. So what we want to do, like a lot of the exercises, we can utilize a ball. So if you have a lacrosse ball, tennis ball, baseball, we'll stay away from like a foam roller for the purposes of this because it gets a bit awkward when you're trying to free up the neck with a foam roller. But any ball that has a density that you feel comfortable with, you can chop and change the type of ball depending on the amount of pressure that you're looking for and how much, when you get some feedback of how this exercise goes for you, you might want to sort of dial that ball up or down a little bit in terms of density depending on how tender it might feel. And the other thing to think of is we're going to do this lying on the floor. You can do it up against a wall if it feels more comfortable for you. The surface does matter, so if you do it on a hardwood floor, obviously you'll need to balance the density of the ball to make that more comfortable for you. But obviously today we're going to do it on carpet. So what the idea with the exercise is, and if you've seen some of these videos before, you'll know where we're heading with this, but the idea is with the spine down the middle, so the bumps down the middle of the spine, either side of that are where the joints tend to reside. So pretty much right next to it. So if this is where the spine is, the bumps on the spine at the back, if you let the ball sort of roll off to one side or the other when we're lying down, we're looking for an area that feels stiff, tight, possibly tender. And again, the tenderness isn't necessarily the most important symptom that we're looking for in this exercise. It is to you obviously if it does hurt, but if you can take note of where it's tender, but then also get a sense of underneath that, does it feel stiff, tight, restricted? Does it feel like it sinks in easier or harder than another spot? Because those stiff and tight spots are the key to releasing a lot of the dysfunction that happens with the neck. So how that looks, so we'll get the trusty ball. So we're going to put it in on the neck, just not on this side for me. So how it looks is that we're putting the ball on the ground. So I'm starting in the middle up the top here. I'm just rolling off to the side closest to the camera. And what you'll find is you'll need to turn your head a little bit to that same side and you'll feel like you sort of come to a bit of a bony shelf. And that sort of correlates with the bones obviously, but also it's going to give you a great opportunity to impact the joint stiffness. So like a lot of these exercises, we're not really interested in you rolling around because it doesn't give you enough constant specific pressure through a joint to get it to give. We want to make sure that you're putting some pressure on that spot for a while. But what we're looking for is just want to move the ball around until you feel like you get to something that feels a little bit tight and stiff. Now, again, if it's tender, respect that. But what we're more interested in, as I said, is that stiffness and tightness. So if you're not sure what stiffness and tightness feels like, then compare it to the same spot on the other side. So for me, if I just move my head and look to the other side, and then I'm on the same spot, and it just doesn't feel as restricted, it doesn't feel as tough, it feels like it sinks in a lot easier, it just doesn't feel as interesting. So I know that even if I had a lot of pain on the right-hand side, for me, the right-hand side here, but I feel the stiffness is more on this side, then this is actually the side that I need to spend more time on. Obviously, mechanically, if something's a bit rusty, that rusty segment can create some dysfunction anywhere around that through compensation. So if we're just treating the compensation of the end result, we're missing the unsexy piece of the puzzle in the middle there. So again, we're looking for stiffness and tightness, not necessarily tenderness. They can be on the same side, but if they're not, it doesn't matter. So we want to spend 30 seconds, a minute on this spot. And then once you've done that, the exercise is simply just moving the ball down slightly. So you feel like you hit another spot, which is most likely going to be another stiff joint. So again, we want to stay here. Just let the ball sink in. Again, if you're not sure whether it's stiff, just compare it to the other side. And for me, again, it doesn't feel anywhere near as stiff and tight on this side closest to the door. So the important thing is, or one of the things to note is, a lot of people find with these exercises that the stiffness doesn't go from one side to the next, one side to the next. It doesn't crisscross often as it goes down the spine. Based on the asymmetrical nature of a lot of the shapes and positions and postures we get into throughout the day, we're often sort of asymmetric over a broad area. So if you're, say, looking down into one side a lot, that whole neck often twists to the one side, and depending on how sort of far up and down you look, depends on which segments take the greatest load. So the point of this conversation is to say that if you feel, as for me on this side, was a little bit stiffer up the top, it's unlikely that it's then going to be stiff on the other side, then the other side, then back and forward. It's most likely going to stay stiff down that same side. So you can just spend your time segmentally working down those levels until you feel like you've run out of interesting things to push on. Now, what I would suggest, and we do this for every exercise because it's really important, is before you do it, test your range of motion first. You want to get a good sense of how you feel and how you move going into the exercise, so that when you've done it, you can compare that same movement again and gauge whether you've made any change at all. Because as we always say, if you can't see change, there's probably no change. And we don't want you to do anything that wastes your time. We want you to do only things that you genuinely feel are important and can make a difference quickly, because it should, otherwise it's probably useless. So for me specifically, what I get a lot of my patients to do, what I'd recommend you do at home, is just be in a good position and just simply turn your head to one side, see how far to one side you can go, take note of how it feels. Does it feel tight? Does it feel stiff? Does it feel painful anywhere? And then compare the same thing to the other side and see how that feels. Now, having just done that, I can feel like that part of my neck is a tiny little bit freer than what it was before. But like I said, it matters how you feel before, it matters how you do the exercise, and it matters how you feel afterwards. So make sure you spend some time doing that over the next couple of days. Work your way down to sort of the mid shoulder blade area, so halfway down your shoulder blades, because we don't often realize that when you do turn your neck, we often sort of utilize a lot of the segments in the upper half of the back to do that as well. So if they become stiff, then it can act like a bit of an anchor and a handbrake, so that when you're trying to move, it doesn't necessarily allow you to do what you want to do. But with something as simple as a lacrosse ball or a ball, you can just work your way down those areas, making sure that you hit the right spots, and that afterwards it feels genuinely looser. Now, so again, we sort of talk about how to do the exercise, why it's important. The third piece, again, if you've been following these videos, the important conversation that we often miss in regards to these issues is why they're there in the first place. So if you wake up in the morning and you think, gee, my neck's really stiff, if you're just doing something simple and you turn and you think, that didn't feel very nice, there's always a reason for that. And what we find clinically is, even though it sometimes takes an activity or a movement or a moment to let you know that something's a problem, that's less likely to be the sole reason why it's a problem. And what we find is that if you wake up stiff in the morning, or if you move a certain way or move the wrong way and your neck feels a bit uncomfortable, we want to think of those moments as more the trigger or the last straw, not the start of something brand new. Because what we know is that the body is really robust, it's really adaptive, and it's not that you go from being perfect to having an issue in an instant. It takes a while for your body to build up to a point where it reaches a threshold for dysfunction. So what we say to a lot of patients is, the morning stiffness is a really good example, is that if you wake up stiff and sore in the morning, an interesting fact is it's not necessarily your pillow or your mattress or your bed or you sleeping funny as being the reason why that happened. It certainly feels that way because when you go to bed, you feel normal for all intents and purposes, and then the only thing that's really changed is that you've been asleep in your bed. So it makes sense on some level that you were fine, you slept, you're now not okay, and that something must have happened while you were sleeping. And while technically something did happen while you were sleeping, it's not because you were sleeping or the position you were sleeping in. Again, what we find is that it's often a consequence of what you were doing the day before. the positions and the postures that you were getting into. When you go to bed and you go to sleep, your body has a chance to recover, so that when you wake up in the morning, you get the legacy of that. And it's a very similar idea to DOMS, which is that delayed onset of muscle soreness. If you were going outside and did a heavy workout, if you ran up hills for half an hour and did 1,000 squats, if you woke up the next day in the morning and your legs and your quads were burning and they were really stiff and tight, that appears normal because you can rationalize what you did the day before. There's an obvious thing that you can connect the dots to, and it's not a big deal. But because posture and positions aren't sexy, they don't often stand out. They're often something that we're doing while we're doing something else, like using our phone, watching TV, working from home, whatever it might be. So the nature of how we position ourselves gets lost amongst what we're actually doing. So if you wake up in the morning and you feel a bit stiff, don't blame your pillow or your mattress or maybe the sleeping position that you're in, because 90% of the time or 99% of the time they feel good. Nothing really changes day to day, night to night for you or for a lot of people, excuse me. But the time spent in awkward or imperfect positions throughout the day stacks up. And what we find is that if you look back from the moment you wake up and feel stiff, if you look back and think, gee, what positions was I in? It's very likely you'll find that there's a theme of what you were doing throughout that day or the days leading up to that point, which led you to feeling that way. Excuse me. So what that speaks to is this idea that if your neck and even your upper back feels really stiff for whatever reason, if you have pain, there's generally a positional or a postural shape that you're beginning into without maybe realizing it as much as you should, that you'll need to pick up on and improve upon if you want this to go away for good. Because if you spend 5-10 minutes, half an hour each day, maybe in front of the TV before you go to bed, freeing up your neck to the point where you genuinely feel like you've made some fantastic improvements in your range of motion, how you feel, that should never come back again, or you shouldn't regress unless you follow that up with a consistent array of positions and shapes that's overloaded and ask it to stiffen again. So to cut a long story short, we need to pair up some good symptomatic treatment, some really fantastic exercises with an awareness and practice of better positioning. Otherwise, you'll always have to keep doing the same thing consistently. You'll never be able to break that cycle and then just end up going back to where you want to be. So hopefully that's helpful. If you have any questions about that exercise, please let us know in the comments below. As always, if you're happy to subscribe to the channel, there's a little notification button you can click to get notified when we post. It's just a great way to support the channel, support us in general, but to help it grow and to help these videos, which hopefully have some little morsels of good information that you may not be picking up anywhere else. It'll help those pieces of information get to more people. So we appreciate any support that you can give us, because we hope to obviously be giving back quite a lot in exchange. So until next time, again, we're bringing out videos hopefully every day. If you enjoy them, please leave a like and let us know. But until then, we'll see you soon. Bye.